And that is why we have also been able to finish school. Studies show that mental health affects everyone. It does not discriminate gender, religion, status, or class, age. So we are all candidates of mental health. We also have learned that 1 in 4 people in our country, and especially those who visit outpatient hospitals, have a challenge with mental health. And we know that what mental health, it's not the normal daily stresses that we face on our day-to-day life. And that is why we have tools and professionals who can help us to know our mental status. 2 more things I want to say. Why mental health is important for healthy living and well-being. We know many people who flounder with their health and they don't enjoy life. For work and productivity, when our mental health is up to date, we are able to be productive at work. Healthy relationships and interactions. When our mental health is good, we can forge good relationships, we can enjoy interactions at family level, work, and even at university. And for decision making, creative thinking, and problem solving, for self-management and self-care. And today we have lost many Kenyans, young, old, middle age, due to issues of mental health. The current threats, we know that it is affecting us. How can you know that someone sitting next to you have mental health challenge? Sometimes it's extreme exhaustion. People are tired to the too much tired. Excessive anger, someone is always angry, being sad and crying at times, having teary eyes, withdrawal from people, or being lonely, hopeless feelings, feelings of despair, and feeling like you are hopeless and worthless. And sometimes it's the compulsive need to be liked, to be praised by other people, which we know very well that it is not possible for you to be loved by everyone. Let us know that we have people who will never appreciate our opinions, and that is not a problem that should take us down mental health. Dressing down, procrastination, and the beauty is noticing the red flags, because you'll be able to accept, be aware, and talk to a trusted person. In our country today, like we've had our girls present, we have the counseling services, we have rehabilitation centers, we have hospitals that are doing very well in mental health. We have psychiatric help too. So we are not children left alone. How do family and friends help? And what about our neighbors? Parents, you are here today. Talk with your children and listen. Ask questions. Support them. We have a tendency of thinking now they are mature, they are in university, but sometimes it is important to keep abreast to what is happening to our children, get into their world, know their academic progression. As we celebrate today, we have parents who are frustrated because their children did not finish school. They dropped out. They got deferred, and you are not told. And sometimes you are not told because you don't have to listen, time to listen. Parents need to know that students encounter many challenges, even as big as they look: academic overload and adjustment challenges. We have challenges of substance abuse today, and you realize that online purchase has escalated to having the problem of drug abuse at the comfort of their home or wherever we stay, we can ask for these substances. And we have seen in our country, in our institutions of learning, that addiction is real. And the packaging is done so well that it entices people. The locations are well set and open 24 hours. So that is why we need self-awareness. And I'm not saying that it is wrong to indulge, but overindulgence is wrong. And the challenges we face today of unemployment, family of origin issues, divorce and separation, financial challenges, and sometimes it's too much money, like we've been told here. We make sure that our children are so comfortable and they have nothing to think about. Sometimes it can work negatively to them. So let us be observant as parents, as lecturers. Let's be each other's keeper and help one another in times of mental health or other challenges that we may face. We have the problem of young children and adults using phones. Nannies will give your child or grandchild their phone so that they are able to work without interruption and to also make sure that they are eating their food quickly. And some nannies have given children alcohol so that they can sleep for long hours. Please, these are matters of integrity. We need to be observant and we need to change our way of things. As I conclude, the red flags that we should look at, if someone is having self-harm tendency, self-cutting, and self-hate, these are serious indicators of mental health, including the suicidal feelings. Conclusion, learn that anybody can be a victim. There is help that is available. There are clear signs and symptoms. If one is keen, many don't look for help and many look okay. Sometimes it's because of stigma. But help, if it's sought early enough, it has prevented many people from digressing to serious mental health. I wish you well.